there's still persistent misinformation. You can't believe, that some of the things we take for granted about how HIV is transmitted and how you can prevent yourself from getting HIV is not known to most of the public out there. You cannot get HIV by sitting with somebody or beside somebody who is HIV positive, by sharing a cup with them, by shaking their hand, by hugging them, by eating or drinking from the same cup. You can definitely get HIV, or you increase your risk of getting HIV. HIV is predominantly sexually transmitted, especially here in Uganda. So sexual contact with somebody who is HIV positive, when you're HIV negative, you're putting yourself at very high risk. Mother-to-child transmission is the other method. Sharing needles and other sharps. If one person is HIV infected and the other one is not, increases the chances. And those are predominantly the major ways. In the older days, the olden days, blood transfusion used to be, but it no longer is, because blood transfused in our hospitals is largely safe. And if you are taking blood from an accredited health facility, you're not at risk of acquiring HIV. But if you're not using condoms correctly and consistently with your sexual partner whose HIV status you don't know, or if you know it and it's positive, you're increasing your risk of getting HIV. If you're engaged in transactional sex, you're at risk, because somebody who has paid you, it reduces your power to negotiate for safe sex. So multiple concurrent sexual partnerships, inconsistent, incorrect, or non-use of condoms, transactional sex are some of the risk factors. The other risk factor is income inequality. That again, those categories, because of vulnerability related to income, they are forced to look for ways of survival, and that pushes the individual into transactional sex, and therefore